Hi everyone. I'm a little bit shorter than everyone else. So thank you so much for the opportunity to partner on this event today. It's really important. And for those of you who don't know me, I'm Dr. Laura McGowan and I'm a psychologist by background. I'm a lecturer in the Centre for Public Health at Queen's in Belfast. And I'm also here in my capacity as the lead for the Association for the Study of Obesity UK's Northern Ireland network. And we've had a really fruitful cooperation over a number of years now with safefood and ASOI. And actually the last time that we covered this topic was in 2016. And that was the first time that it was raised. So I was really hoping to hear progress today, even if it's slow and pocketed at times. And I think really the answer is yes, there is evidence of progress, so that's good, that's the positive, but there's also a lot of work to be done. So number one, thank you to safefood, especially to Anne and so on, for all your great organisation of the event, and also to ASOI and to Nieves for giving us the great introduction. I think that it was really powerful to hear such a range of those lived experience voices today, and that's something that we really advocated for at the outset of this event, because we know that that helps us to understand the topic, it helps us to change the narrative, and without that, progress won't be made. So I'm delighted that we heard so much from Sarah and from Johnny and even Susie, who kind of tied in her own experience as well, telling us about ICPO. So I'm really just going to give you three closing reflections. I'll keep them brief. So the first one is that this work is not done. So unfortunately, it would be nice if we weren't in this position of having to have this topic raised, but we are. And so there are things that we can do. And I was delighted to hear from Sarah and Johnny, have their voices heard. But of course, the things that they were talking about were not comfortable. No one wanted to hear the negative experience that they've had to go through based simply on their body size. But it made me realise that there is still such a lot to be done from a societal point of view. We've got to change the narrative around the views of people living with obesity or living in larger bodies. And really, Susie, I think, set the scene really nicely on some of the more practical things that we can do around that to try and end that on a positive. So things like embedding obesity stigma, the implications, the ways to avoid it, the pervasive nature of it and so on into medical education curriculums, because we know that in healthcare settings that is a particular challenge. So something that I do in my teaching with the medical students in Queen's, and I'm pleased to say, to hear about the great work that's going on with ICPO on that front. My second reflection really is around Stuart's point that we need to change the system. So we need to change the system at many levels: structural, environmental, the commercial determinants of health, all of those things. But within that sort of whole systems approach, we also need a really clear place for prevention and for treatment of those who are already living at a higher weight, if they so wish that support. And that's not something that we have, certainly not in the north of Ireland at the moment. And obviously there's great strides being made in Ireland in terms of the model of care and the implementation of the guidelines. And I hope that that is resourced well and evaluated well to see how things go. But we certainly have a lot more that we can do. I think that one of the things that struck me was, Stuart, a comment you made about how, this kind of, it boils down to this simplistic narrative, but actually it's moving in the completely opposite direction to the research and the evidence base that we have, which really highlights the complex and multifactorial nature of the development and maintenance of obesity as a disease, as a chronic relapsing disease. So perhaps one of the first things that we could do is to start to move obesity from being categorised as a behaviour in some of these documents into something that is an outcome. So I think that's a fairly straightforward step that we should all be able to take. And we should be championing that in any of the roles that we're in. So finally, I'd really just like to encourage everyone actually to take up Nieves' challenge. So right at the start of today, she set everyone a challenge to ask us, well, what will we do? What is our role in helping to reduce or eradicate weight stigma, obesity stigma in particular? And I think that that's something that each of us can do here today. Like I've said, my hope was that we didn't even have to kind of have events on this topic repeatedly, but we do. So let's think about those positive steps that we can take. It starts with education, yes, but also upskilling, and a hugely important part of that is listening and involving and working as partners with those with lived experience. So I think that is really, really great. And obviously ICPO has kind of come up, and we didn't have ICPO in 2016, so that is one hugely positive step forward. One other, some might view as small but really significant step that we can take is that of person first language, which Niamh also educated us as to at the start of the event. So please do let that sink in. Talk about people with obesity and not the other alternative. Think about families affected by, families living with obesity, a person with obesity, and so on. Please think about that. Think about the words that matter and move forward with that. And that's it. Thanks to all involved in the event organisation today. I'm delighted to have been involved in it, and I really look forward to welcoming you to the UK Congress on Obesity, which will be in September, the 14th and 15th of September 2023 at Queen's University, Belfast. Thank you.